In terms of Aim to Inspire, what do they do for you?
They like, you get medication, you see your day programs, and right now I'm trying to get food stamp, but my mom has to give him a picture of my birth certificate so I get food stamp. Because right now, I don't really have anything in my apartment to eat but a bag of rice and water.
As part of our ongoing investigation into what advocates and lawyers call senior trafficking, where vulnerable adults are housed without proper oversight and care, Spotlight on Maryland began examining a nonprofit called Aim to Inspire Care Forever Limited last fall. We obtained this, a 10-page order of emergency suspension issued by the Maryland Department of Health to Aim to Inspire at the end of January. So you're saying sometimes people are aggressive with you?
Yeah, or some of the workers. So I just give them a smile and enjoy it.
Yeah.
It's called following the rules and, and appreciating, because I don't want to get put out on the street.
We did speak to one of your residents. Last November, we confronted DeQuan Thomas, the leader of Aim to Inspire Care Forever, about conditions inside his operation.
We go beyond and above to make sure these people are not on the streets. We are very, very upfront, When these individuals come in, we say, this is what it is. We can also offer them to go to, other places, etc. With the verbal abuse or anything of that nature, if anything is brought to me from a resident, I am a person that acts on it. They're receiving transportation. They're receiving a lot of services. And they might not say today, though, but where can you live and pay $600 and receive food, clothing, shelter, transportation, resources, medical attention, etc.? Nowhere.
Well, assisted living facility, though, right?
Yeah.
3 days after a report aired, a multi-agency government operation descended on Aim to Inspire on November 14. Do you work for these guys?
Yes, I do.
What occurred today?
Nothing.
Nothing at all? With all these fire officials, there wasn't a single thing?
No, they just wanted to see what a wonderful job they were doing.
The wonderful job that you guys are doing? Okay. After that visit, we confirmed multiple residents were transported to an area hospital. An official told us that they were in bad shape. Despite that, the facility remained open. State and local officials returned more than a month later on December 18th. What's going on today?
Taking care of our people, that's what.
There appears to be multiple government agencies on site. What's the reason for that?
I don't see no government planners or nothing.
There's vehicles clearly marked government.
Vehicles over there too.
Okay. Okay. Well, we appreciate it. Nice to chat with you.
You too, Gary.
The emergency suspension order says state health surveyors found serious deficiencies, including failure to provide skilled services under the supervision of a registered nurse as required by state law. The order also states Aim to Inspire accepted clients whose needs exceed its legal scope without arranging the additional care required.
But I think for nursing homes, there's a little bit more accountability.
Tia Witherspoon is the executive director of Maryland's Office of Healthcare Quality, the agency responsible for oversight. She was questioned last Thursday by state lawmakers about failures inside nursing and assisted living homes.
The overarching theme that we see here in the state is building issues. And unfortunately, it takes quite a bit of capital to renovate these buildings. So they have to do, repairs where they can, but this is the majority of what we see.
After hearing building issues described as the primary problem, we asked why it took more than 60 days to shut down an unlicensed facility where residents reported neglect and abuse. Excuse me, Executive Director Witherspoon? Executive Director? Hi, yes, Executive Director. My name is Gary Collins. I'm with Fox 45. I was wondering, why did it take you 60 days to shut down an unlicensed assisted living facility in Baltimore when there was clear neglect and abuse that was happening, according to the people that we spoke to?
So, Gary, we look forward to working with our colleagues here down at the State House to address any issues that we have with unlicensed facilities, and I will refer the rest of your comments to our...
Is it true that you went ahead and told staff to not speak to the press? Is that true?
We'll refer the rest of your questions to our MDH communications team. Thank you.
Not much of an answer from the Office of Healthcare Quality's executive director. In an email, the Maryland Department of Health says it does not discuss potential or ongoing compliance matters and provided no timeline for action. As the state declines to explain its delays, vulnerable adults remain caught in the middle. Spotlight on Maryland will continue to track how and how quickly Maryland enforces the laws meant to protect them. I'm Gary Collins in Annapolis with Spotlight on Maryland.
Daquan Thomas, leader of AIM to Inspire, did not return Spotlight on Maryland's request for comment. Now, if you have a tip for our Spotlight on Maryland team, you can call them at the number on your screen. It's 410-467-4670. I'm Kai Jackson. Thank you for watching. Here's another video to watch. Also, please take a moment to subscribe to our channel.